to Dialogue, KSFR's Friday evening talk show where the conversation starts with you. I'm your host, MK. And today joining us is a local pioneer who is paving the way toward new alternative treatments in mental health. And as we continue to push the conversation forward in what those new horizons look like, we are joined by none other than Kevin Hennely. He is the founder and director of Santa Fe Hearing Voices Treatment Center, which is specifically dedicated to the treatment of voice hearers and their families. And if you haven't been listening for the last few weeks and you're just tuning in, what we're talking about when we refer to people as voice hearers are people who in mainstream society often referred to as people who suffer with schizophrenia. That term is now being changed to people who hear voices. It's a more destigmatizing terminology that people who suffer with that condition or that state of being prefer to use. And so we are embracing that term. Joining us today is Kevin Hennely, who is the founder and director of this Santa Fe Hearing Voices Treatment Center, and he's here to tell us all about his program. He has graduate degrees in counseling and psychotherapy. He has over 25 years in private practice and community mental health work, and he is here joining us today. Thank you so much.
Good. Hi, MK. Thank you for having me. It's a delight to be here with you.
It's a delight to have you on our show. Well, I am so excited to hear about your center. So will you tell us what inspired you to begin this Santa Fe Hearing Voices Treatment Center?
Well, a few years back, I was working at a local mental health agency, LifeLink, which is well known in the community, and I was seeing a lot of clients coming through who were either diagnosed with schizophrenia or would disclose that they were hearing voices and had a history of hearing voices. And in either case, they weren't getting any real help for those conditions. And that's traditionally, as you know, what's been the problem with schizophrenia is there's really been no alternative treatments, and the principal treatment has been medication that has not really helped most folks who hear voices. So I was not really in a position to do much myself, but when I was really looking around for alternatives, I went to a training given by Ron Coleman and his wife Karen. They had come to Santa Fe from Scotland, and they were very much involved in the hearing voices movement in Great Britain for 25 years. And during that training, Ron and his wife gave some basics of the hearing voices movement that I think were very, very applicable to alternative treatment. And primarily, it was a different way of relating to voices, taking the voices seriously, accepting that people are actually hearing voices and telling them that it's just in their head, and helping them to relate to the voices differently. So what I did at LifeLink, along with other staff, is we put together a program that would be agency-wide where voice hearers could get therapy, they can get case management, they could go to a clubhouse, which is a day program if they wanted to, and the staff would understand what the voice hearing is about, and that we could inform the psychiatrists of how we were working. And there was a number of reasons to do that. One is that, as I said, there needed to be a different approach to treating voice hearing. And the other major thing is that a lot of voice hearers also had other problems they had to deal with. They may have had a trauma history or a history of anxiety before the onset of voices, or family issues. And often those other conditions were untreated because they were diagnosed with schizophrenia, and the conventional wisdom is that you don't do therapy with people who are diagnosed with schizophrenia.
They just think you're supposed to medicate it, and that's all.
It was pretty much the paradigm that I was exposed to when I went through training in my early years. You just don't, and psychiatrists are not going to spend time listening to people's voices and what they're hearing. And so it's very much dismissed And of course, families don't know what to do with it, and they get exasperated.
Yeah.
And so the voice hearer often feels very lonely. They're having these experiences, and no one wants to really relate to them.
Yeah, I'm curious. I've been curious about this. Do many of them actually hear voices have a long time history of hearing voices, or is it something that comes up, say, in the teenage years? And I know there seems to be, according to some of the stats I've read, that it shows up in the teens and then kind of goes through maybe into the early 30s possibly. But do some of these folks have history of hearing voices from when they were young, from way back?
A lot of them do. A lot of them started hearing voices when they were children. They might have mentioned it to their parents, thinking that maybe it was an imaginary playmate, something along those lines. Didn't follow up, and the voices continued. In those cases, and they're not few, there's a lot of those cases, the voices were often relatively benign in childhood, but it was in the teen years that they turned what I would call very negative, very critical, which often precipitated the crisis. Then the person would end up in a hospital, in an ER, in a community mental health agency, and get diagnosed with schizophrenia. And then the belief is the onset was at that point, but the onset was often much earlier. And so a lot of these folks had a history of voice hearing, but no one knew it. And I can give some examples of that, which are really striking. I started working with a 14-year-old boy a couple years ago, and he had started hearing voices at age 8 and didn't tell anybody until he was 12, at the point where the voices were getting out of control and he had to drop out of school. But he had lived with the voice hearing for 4 years without anyone knowing it. So there's a certain isolation that can settle in with these young folks who don't know who to turn to or where to get help, and the parents often don't know how serious the problem may be.
Yeah. So keep going. I didn't want to, in terms of what you were seeing in the front lines of the older paradigm of treatment.
Well, so the Hearing Voices movement that I was exposed to in that training, that had started in Europe, in Belgium and Denmark in the 1990s, maybe the 1980s, and then it really took off when it spread to England and Scotland and Great Britain, and then over to Australia, and then eventually to other areas in Europe.
And have they been successful?
They've been very successful. If you could go online, let's say recently I typed in Hearing Voices Movement in Ireland, and there were a number of Hearing Voices groups around Ireland. Also, it's in the English-speaking world for sure, less so perhaps in the non-English speaking Europe, but I think it's also making inroads there. It was slow to catch on here in the U.S., and it's only been in the last 5 years or so that it's really grown in popularity. More and more Hearing Voices groups are being set up around the country, and it's giving voice hearers a different approach to their voices. Now, interestingly enough, in 2015, a study came out, and it was funded by the Robert Wood Johnson Foundation, which funds a lot of studies in mental health. And there was a multi-year study that was done in 5 community mental health agencies. And basically the findings of that study were that if you give someone who's diagnosed with schizophrenia, which was the criteria for the study, they were still using that term, if you give them therapy, intensive case management, family therapy, and you go light on the medication, you have much, much better outcomes. So right there, you already have some evidence-based data that a different approach can help and will help.
And this hearing voices movement was started by peer groups, wasn't it? Was it a peer group, or was it therapists? Or tell us a bit more.
Well, it was a woman in I don't remember right now if it was Denmark or Belgium, but she was working with a psychiatrist, and she was insisting. This was about 1988. She was insisting that her voices were real and they had meaning, and the psychiatrist eventually agreed with her, which was unusual at the time.
Yeah.
But what was really important at that time is that the psychiatrist's wife was a researcher, And they went out and found a number of people who heard voices. Okay, they just put out an ad somewhere in the radio, local newspaper, and they captured a number of folks for the study. And what they found is that a lot of people who heard voices, but they never entered the mental health system. And then they went to those people and said, what are you doing that's effective in your voice hearing that you don't have to get psychiatric care, that you're still functioning in society? What came out of that is they realized that these people had a natural ability to either distract themselves from the voices or to relate to them differently. And then the psychiatrist and his wife began to pull this research together and put together something that could be helpful for other voice hearers based on those initial findings. And that gave birth to the Hearing Voices movement. Now, in its origins, it was meant to be very peer supported, because in Europe, the problem was the psychiatric system was very hierarchical, more so than it is here. And it was easy for folks to be hospitalized and remain in hospitals for long periods of time. So the movement wanted it to be more peer run, so that a voice hearer would actually coordinate and run the Hearing Voices groups. And that's the way it is pretty much still in Europe. In Santa Fe, what we're doing, particularly at the Guidance Center, and what I do, not the Guidance Center, but LifeLink, and in my own treatment center here, is that the therapist is very active, and they often work with peers, but not necessarily. And part of the reason is that when you begin to work with voice hearers, as I noted, there's often other issues that have to be dealt with, and it takes a therapist's expertise to work with those, or training. So anyway, the Hearing Voices movement has made inroads in the U.S., and it's one of the many ways that folks today are trying to come up with different ways to approach voice hearing. And so it's kind of an exciting time as the old paradigm around schizophrenia is beginning to weaken and fall down, and it allows for new growth, new possibilities for the field in general, and also for the voice hearers themselves.
Yeah, it's really exciting. Is it sort of similar to open dialogue? I mean, the approach. So if I were to go into a Hearing Voices meeting, what would it look like? Say a peer support meeting, what would it look like?
Well, the voice hearers would just have a venue, a place, just to talk about their experiences.
Kind of like an Alcoholics Anonymous.
That is exactly the model, although, I mean, that's the closest thing we have right now. It's peer run, okay? Mm-hmm. Now, remember, well, you wouldn't because you're not of that age, but back 30 or 40 years ago, Alcoholics Anonymous wanted nothing to do with therapy. Uh-huh. They didn't want it at all. Therapy wouldn't help. Uh-huh. That's the state of therapy back 30 or 40 years ago.
Right.
If you go to an AA meeting or an NA meeting today in Santa Fe, a lot of the language you're going to hear is therapy language, because a lot of these folks are in therapy, and they're realizing that there was a substance abuse problem, but there were other problems too. Right. So AA or NA, peer run, couldn't address effectively some of these other problems. So a lot of folks who end up in a 12-step program are also in therapy at some point. Mm-hmm. And this is what we did at LifeLink, and I'm doing here in my own center right now, is that we realized it can't just be at a peer-run level. There could be peer-run groups, but there needs to be a higher level of treatment available. Okay, so we've kind of modified the Hearing Voices movement to allow for more therapy, just like the AA movement has evolved over the years to really embrace therapy as another way to help deal with the addiction.
Mm-hmm. And is that partially because, I mean, I find schizophrenia somewhat fascinating myself personally. I mean, so-called schizophrenia again, or just the simple, the experience of hearing voices in that, I was thinking that in some ways, I wonder, and I've read a little bit, that it can be similar to dreaming while awake, and that some people describe it as very much like that. Some people who have suffer from this describe it that way. And if in fact that were the case, then wouldn't you be in a way talking to your unconscious, and therefore then therapy could be helpful to say, get, to maybe these are, as we had a guest on several weeks ago who was a voice hearer, and he actually uses lucid dreaming to go into his dreams, find the voices that he hears while he's awake, and finds them and talks to them, because he believes that all these voices he's hearing are just different parts of himself, has learned to dialogue with them in his dreams to sort of get clarity and say, well, who are you and what are you? What are you about? Well, I'm your fear, or I'm your anger. And he literally finds these things out about himself. And then he says it's actually helped in life. And when he wakes up and still hears the voices, it's helped him manage those voices. So in some ways it seems like I can see why therapy would be useful, if in fact that's even part of what's going on. Do you think in any way that is at all part of what's going on?
Well, in that instance, what this man has done is found a way to relate to the voices that's effective for him. Now,
Yeah.
if he goes into his dreams and encounters something that he feels a voice is coming from,
Yeah.
entities or images or whatever, it's helping him get a sense of agency vis-a-vis the voices.
Right.
In other words, one of the principal problems that voice hearers bring when they come into therapy is that they feel the voice, they have no control over the voices,
Right.
even to the point where they'll do what the voices tell them to do.
Mm-hmm.
Even minute things, when to shower, when to get up, how to walk down the street, this type of thing. So what this particular person has done has found a way to be proactive vis-a-vis the voices and give himself his own sense of power and agency back.
Uh-huh.
It doesn't mean the voices have stopped,
Right.
but he's found a way to relate to them. And that's a very useful way to do it. If you don't do lucid dreaming, there's other ways to personify what you may believe the voices are.
And is that part of what you do at your treatment center with the Hearing Voices Treatment
Well,
Center?
one of the so let me step back. Let's just put aside for a moment where the voices come from, because that's going to be a huge question.
Right, right.
That's going to be
And no one really knows,
the
right?
elephant in the living room.
Okay.
And of course, I approach it the way the Hearing Voices movement approaches is, whatever the voice hearer believes is okay. If they
Right.
believe it's their brain chemistry, it's okay. If they believe it's part of their personality, it's okay. If they believe it's spirit entities, it's okay. All right, whatever they believe, okay, because who's in a position to adjudicate that for them?
Right.
And see, in the past, the psychiatrists were adjudicating it. They were saying it's brain chemistry.
Mm-hmm.
But, we've had the diagnosis of schizophrenia for over 100 years, and we still don't have any biochemical markers of schizophrenia.
Yeah.
So, we just can't say we're eventually going to find it if we keep looking,
Yeah.
because over the last 100 years, and particularly the last 20 years with all the brain scanning, they haven't come up with that.
So from your perspective, and I don't mean to interrupt, but that's still a rather big point of contention, right? I mean, there are those people who actually believe that, no, we do have evidence of a chemical imbalance or some kind of brain chemistry
It's
or
very
brain
weak.
wiring.
It's very weak. It's very weak. They'll say, well, 30% of people who have schizophrenia have this configuration or this in their brain, but that's very weak. What about the other 70%? And does that really account for what goes on in the voice hearing? I mean, when you really listen to what's going on in the voices, what the voices are really telling a person, it's really hard to account for that with brain chemistry, or even split up parts of the personality sometimes. There's nothing often in this person's past that will account for what's being said by those voices.
Mm-hmm.
You see, what's being said by the voices. So, for example, a person can have, maybe some problems in childhood, maybe some trauma, but doesn't reach the level of PTSD.
Right.
Okay. And then
because that's another theory that it's like it's all from trauma. It's all trauma born, but that's not.
I don't think so.
Right.
A lot of my clients haven't had trauma.
Right. That's what this
Okay.
person, the guest on our show said. There's no trauma, and that also can reflect badly on the family. Then the family carries this shame of, oh my gosh, when sometimes you have the most loving families whose children are experiencing.
Well, that's exactly right.
Yeah.
And then if it were trauma, let's say if the voice hearing was a symptom of trauma, then if you resolve the trauma, the symptoms should go away.
Right.
And it doesn't. You see? Even Ron Coleman, he was in hearing voices since he was in his 20s, and he's probably 60 now. He had an abuse history, which he disclosed and shared. And he went through therapy, resolved a lot of the trauma. The voices continued.
Yeah,
okay.
yeah.
So
in some ways, really, it's kind of an irrelevant question anyway, right? Because the point is to sort of be able to manage the voices.
Exactly,
right?
Exactly. So if you look at the two issues of voice hearing, one is who's going to be in control, the person or the voices, the person hearing the voices or the voices. The second issue is how to get rid of the voices for people who don't want them anymore. Now, if we look at the first issue, who's going to be in control? When you listen to a voice here and the voices, eventually what the voices are trying to do is put so many thoughts in the person's mind that really don't belong there, that are going to make the person feel depressed or dependent on the voices. In other words, this is one of the reasons why voice hearers lose control of their life, because they lose control of their thoughts. Okay? In other words, you can say one of the battlegrounds in voice hearing is the mind. You see, now we know that not all of our thoughts come from us. That's what advertising is. They do put thoughts in our mind, and they try to create desires and wishes and create motivation for doing things. Political advertising does that too. Everybody knows that, okay? And the voices operate in the same way. They keep telling the person often negative things. It weakens the person, and the person loses confidence, and they begin to believe the negativity of the voices, and then their lives become derailed.
Yeah, okay. And it's got to be so scary. I mean, I think of putting myself in that position again, back to that metaphor of dreaming while you're awake. To imagine, I can't even imagine hearing voices all the time and I keep thinking that it's sort of akin to having when you go to Best Buy and all the clerks have those little earphones in their head where they're listening to their whole staff while they're having a conversation with you. Imagine that times 10, and maybe even some visual hallucinations while you're at it. It's got to be a very distressing place to be. I mean, and I'm so glad, to me, that what makes me happy to hear about programs like yours is that they're more comforting for the person who's under that level of it's got to be huge amounts of stress.
It is, and the Hearing Voices groups are very, very helpful, because often the voice hearers never shared or never had anyone else who heard voices to share with, and they realize they're not alone, that their struggles are often similar to other people's struggles. They could learn from each other what kind of distractions help, how to manage when the voices get very active or very negative or very aggressive. It is very helpful. And these people are really, it's tough. It's very tough. And I admire the folks who are hearing voices and who get on with their life. I had a client who full-time job as a grocery clerk.
Wow.
And he's hearing voices, and he's checking people through, and no one even knows it. And another young man who went back to school to get his GED. And they're still hearing voices.
Yeah.
Now, going back to kind of what I was talking about, the voices, in my experience, listening to the voices and the dialogue, they're really trying to control the person's mind. If you control a person's mind, you can control their behavior.
Right.
Because whatever the voices are, they can't do anything themselves in this realm. Right. They can get a person to do something. Okay. Yeah. And so often I begin to introduce early on in my work with the voice here what I call the ABCs of voice hearing. Okay. And it's very simple, but it's not so easy to apply it all the time. A, don't believe what the voices tell you. And most of the time it's negative. Sometimes it's positive. And the voice hearer says, well, what about when they say something positive? Well, I asked the voice hearer, well, what kind of positive things? Well, the positive things aren't all that positive. It just kind of give them a pat on the head. You're good. You're nice. Things are going well. That's 10%. The other 90% is negative.
Right.
So it's kind of like it's not like being in a bad relationship where they tell you some nice things, but then they abuse the rest, 90%.
Right.
So, well, you don't need that. You know, just do the best you can.
Yeah.
Don't believe what the voices tell you, because most of the time it's going to be negative things about you.
Well, it's sort of like also you can learn to do that. It makes me think about being bullied in school. You have to kind of learn to ignore the bullies. I mean, just ignore them. And so in a sense, these voices can be somewhat like bullies in your head almost.
Well, they are bullies. I mean, they act like it.
Mm-hmm.
Okay, so that was A. The B is, don't do what they tell you.
Mm-hmm.
You don't have to do anything they tell you.
Yeah.
Okay, because what the voices often do is they begin to have you do small things.
Mm-hmm.
Like I said, maybe take a shower at a certain time, wear a certain blouse or a shirt or whatever.
Mm-hmm.
Down the road, they're going to tell you to do something awful, like kill yourself.
Yeah, you hear that.
I mean, they're setting you up. Okay, the voices. Okay, so never do what they tell you to do. Okay, you don't need them to direct your life at all.
And what if they? So I'm putting myself in a patient's point of view, but they say that if I don't do what they say, they're going to kill me.
Okay, that's C.
Okay.
ABC. Don't believe their threats, because whatever the voice is, it doesn't have agency on the physical plane.
How do I know they're not going to? How can I trust you versus my voice? I'm just putting myself in the patient's.
We set up an experiment. Okay, so I said, next time they tell you to do something, okay, I want you to do it. I mean, I want you not to do it, and see what happens. Okay, so they tell you that you can't walk in any cracks when you walk down the street, or that you can't eat certain things, or you can't go certain places. I want you to do exactly what they're telling you, opposite of what they're telling you, and see what happens. So it's an experiment. And I said, if it gets too much, just call me.
Yeah.
I'll walk you through it. Just call me. And so eventually, they get a little courage, or a lot of courage, and they defy the voice. And nothing happens. Nothing happens. So often I'll put a paper clip on the table. Okay. And these are people who are hearing voices going back and forth, and I ask the voice here, could you move that paper clip? Move the paper clip. Okay. I said, all these voices that you're hearing, ask them to move the paper clip. They can't. They don't. The paper clip doesn't move. In other words, they can't follow through on the threat. They can't follow through on the threat. You see, but they'll scare you and say, if you don't do this, you don't do that, something bad's going to happen. Or something bad's going to happen to someone else. This goes back to don't believing what they tell you, because when you listen to the voices, when you really sit down with these people, a lot of it's half truths and lies.
Yeah.
I mean, when it really comes down to it.
Right.
I mean, these are not, you look back in spiritual traditions, religious traditions. And some people will say, well, Abraham heard voices, Moses heard voices, St. Teresa heard voices. And I say, well, exactly, they did. But they didn't hear voices all the time. They weren't hearing it incessantly. And if you go back and read scripture, if you're interested in that, or read St. Teresa's biography or whatever, a lot of what they were telling, most of what they were hearing was not negative. It was trying to guide, or the spirit or world was giving guidance. It wasn't all this negativity. So you're dealing with something, you voice here, you're dealing with something of a different order, So anyway, the ABCs begin to introduce that and it's another way of relating to the voices, where it's giving power back to the voice hearer.
Yeah, absolutely, and it's literally strategizing ways. I was wondering about that, so that's very interesting. You put the paper clip on the table and say, ask the voices to move the paper clip, and they just can't do it. So that's a way to prove to that person they don't exist until you are the person that moves the paper clip.
Right. See, it goes, whatever they are, the voices, the person's more powerful than them.
Yeah.
But the person begins to lose that sense and think the voices are more powerful.
Yeah, exactly.
You see, and I tell the person, you can do things on this plane the voices can't. The only way they can be effective on this plane is to get you to do something.
Yeah.
You see?
Yep.
And you don't have to do anything you don't want to do.
Yeah.
You know?
Yeah.
And the voices will eventually, they're clever.
Yeah.
They'll say, well, they come from God.
Right.
Or they're some bigger than life person. I worked with a
or an alien or whatever.
Exactly.
Mm-hmm.
I worked with a British woman, and one of her voices said it was Prince Charles.
Right.
Okay. They kind of want you to believe they're bigger and more powerful than they really are.
Yeah.
Okay? So again, it's another way to relate to the voices. So introducing those basic concepts begins to shift the power balance over time. Now, a lot of voice hearers, if they've been hearing voices for a long time, it's hard for them not to fall into believing what the voices tell them.
But when you think about it, it's very, it's true of any of us, so-called normal people that don't hear voices. We still have negative things we tell ourselves. They're just not out loud. I mean, we don't hear an actual voice, but I think just trying to stay positive as human beings is a challenge. So I imagine this is kind of, it's almost that same struggle, only in sort of more three-dimensional form in a sense.
Right, it's more intense for them because let's say, normally it's for us to stay positive as we go through our day, the stresses, we look at, conflicts we may be dealing with, and sometimes we do get down. Now, we do our best to deal with it. We may turn to our support system, we may turn to prayer, we may turn to whatever. When the voice hearer gets down, the voice hearer actually begins to hear the voices piling on.
Mm-hmm,
Example, let's say that a voice hearer is in a relationship and the relationship goes south.
Right.
Okay? Well, if they have feelings for the other partner, is going to feel bad.
Yeah.
What the voices do is pile on and say, well, no one's ever going to love you. You're just unlovable. You shouldn't even try anymore.
Right.
It makes it worse.
Oh, my gosh. Oh, how horrible. Oh, that's just horrible.
Yeah, it's horrible. Yeah, so it's very difficult. So I really admire the courage for these folks to stay the course.
Yeah.
Stay the course. Stay in there. Keep trying.
Exactly. We're going to keep this conversation going, but we're going to be right back after these short messages. We're talking to Kevin Hennely from the Santa Fe Hearing Voices Treatment Center. We'll be right back. And we are back with Kevin Hennely from the Santa Fe Hearing Voices Treatment Center. He is the founder of this center, and he deals specifically with people who hear voices, otherwise known as people who suffer from so-called schizophrenia. And we're talking about the challenges of what it is to live with schizophrenia. And, the one thing I'm interested in doing is sort of helping to humanize this experience and allow us to be less afraid of these people and more compassionate toward their experience, because it's just got to be so scary. So when you said, so in normal life, again, I keep quote unquote normal, whatever that is, just trying to stay positive can be a challenge. For these folks, you said the voices, that if I'm having a bad day and I hear voices, those voices are going to come after me in droves and make it a really bad day. I mean, keep me, beat me up even more than I might normally sort of beat myself up as a quote-unquote normal person.
That's right. So when you ask a voice hearer, when the voices get more active or more aggressive, it's often when they're physically tired, they're under a lot of stress, or they're feeling depressed. Mm-hmm. So they're already kind of in a weakened state, as we all are in those conditions. And so that's, in some ways, the voices are opportunistic. The way a virus is, a virus gets into our system and it migrates to the weakest part of our system, and then when our immune system's down because of stress or we're physically tired, then it strikes.
Wow.
You see,
that is just sort of a fascinating kind of element,
right,
of hearing voices.
Yeah. Now, when you think of the the cleverness or the strategies of the voices,
Yeah.
you think, well, how could this come from just brain chemistry?
Right.
It's a little bit off. Okay.
They're mighty and smart, these guys, these voices. Yeah.
Yeah, they can
And
be
very, what's the word, determined as well.
right.
They
right.
seem to almost have a will of their own. I mean, or certainly a certain power, I guess.
Well,
I don't know.
MK, that's right, and that's why a lot of voice hearers, if you ask them where they think the voices are coming from, they will say, well, they're entities, or they'll use a word, a spirit being, something akin.
Yeah.
In other words, that it isn't. They don't believe it's part of their personality.
Yeah.
They don't see them as. Often the voices aren't being heard in their head; they're being heard outside.
Right.
And of course, if you say that to many professionals, they're going to dismiss it out of hand. But this goes to opening up a broader paradigm.
Right.
Now, you and I live in Santa Fe, okay,
Right.
and I've lived here a long time. You're probably native of this area.
Mm-hmm.
Well, when we look at worldviews today, let's say in our community, many people believe in spirit entities, okay, of one kind or another. So let's just look at some of the population that we share our community with. Okay, you have evangelical Christians. They definitely believe in spirits.
Mm-hmm.
Catholics do.
Right.
Okay, it's all biblically based. You have New Age folks
Right.
who believe in spirits.
Mm-hmm.
You have the Buddhist community who believes in spirits.
Mm-hmm.
You have the Native Americans.
Mm-hmm.
So what they do in the Cubans, they evoke spirits in.
Yeah.
And
Yeah.
you know, and you know, you grew up and you know, many people, you probably knew the older folks would say, you know, that the grandmother visited them one night or came to them in a dream or whatever. So
Mm-hmm.
in terms of people's day-to-day life, many people believe in these spirit entities. So I can tell you stories about, I happen to believe in spirit entities,
Mm-hmm.
and I believe that they are, in many cases, or at least some cases, the cause of the voice hearing.
Mm-hmm.
So I was doing a group.
Wow. So you actually believe it could be.
Yeah. I was doing a group one day. It was over at LifeLink,
Mm-hmm.
and a man came through, a middle-aged man, and he, through Santa Fe, and a lot of the homeless people end up at LifeLink,
Yeah.
you know, and then they move on. A lot of times they end up staying in Santa Fe, but he had heard voices started hearing voices when he was about 30. And his story was this. He was from California. He was homeless. He was at a shelter in Santa Rosa, which is in Northern California, and he woke up in the middle of the night hearing voices. And of course, he was upset. He was distressed. So they took him to the local hospital, and he was diagnosed with schizophrenia. So for the following 10 years, he's trying to figure out how to get rid of this voice.
Mm-hmm.
Okay, and he was really convinced that he had picked it up at that shelter.
Uh-huh.
Okay, and he was sharing.
Yeah.
And it was a group. He was sharing. Well, the woman who was sitting next to me was a seer.
Mm-hmm.
She could see.
Mm-hmm.
Okay, so after the group ended and everyone left, I turned to her and said, "What do you think of his belief that he really has an entity, really picked up an entity?" He says, "For sure, I see it right behind him."
Wow.
Yeah.
So maybe some of these
Yeah.
these hearing voices meetings actually, who's to say?
Who's to say?
I mean,
Exactly.
have entities in
Yeah,
these.
right. And I've worked
meetings.
with different kinds of healers who
Mhm.
actually could see entities and would remove them
Mhm.
from the person without, and often the person wasn't hearing voices, but it was disturbing them in some ways.
Mhm,
Okay,
mhm.
so this is one of the perspectives that's kind of emerging. You can call it the more shamanistic perspective, but it
Mhm.
doesn't have to be shamanistic.
Mhm.
You know, for example, many voice hearers will end up going to an evangelical church or a Pentecostal church because an aunt or a cousin says, "Come and we'll pray over you." So it would be another way of removing the entities, but often it doesn't work, and there might be different reasons for that.
Mhm.
But again, so that's a hypothesis that I think is a working hypothesis. But it really, if you were to entertain that as a hypothesis, you'd really be standing outside the prevailing psychiatric paradigm.
Right. They'd all say, "Oh gosh, they're
Yeah.
crazy."
Yeah.
I mean, you know,
Yeah,
they'd
but
get put into the same.
that's
but-
okay.
Right.
I mean,
It's a different cultural perspective, a different, I mean, even
Yeah.
from an anthropological point of view, completely different perspective.
right.
And whatever works. It seems to be at the end of the day, it's really about whatever works. And it seems as though being able to work with individuals as individuals instead of cookie cutter disease model, you're able then to work with people more effectively. I mean, is that true? Do you find that happens?
That's exactly right. The bottom line is what works. So if they believe it's entities, they believe it's because of their trauma, if they believe it's brain chemistry, whatever they believe is okay with me. I want them to be able to regain control of their life. And that's the bottom line. Okay.
Yeah.
Now down the road, I can say, well, if you regain control, if you get your life back on track, then you could look for different ways, maybe, of getting rid of the voices. But that's a different issue. I mean, it's a big issue, but that's something that I tell people, I don't have that ability to make the voices go away or get you to stop hearing voices, but I can help you to regain control of your life and pursue your goals and dreams that you left behind when the voices became too problematic for you.
Yeah. I'm also curious, have you ever developed, how do you develop strategies to deal with visual hallucinations?
Right.
Are there specific strategies for dealing with things like that?
Well, I would approach any of those phenomena by listening to really what's happening. What are they seeing? How are they feeling about it? How is it affecting them? Now, most voice hearers don't have visual hallucinations, but some do, but they're not that frequent. Okay. Now, keep in mind, there's different reasons one can have visual hallucinations. You could have severe depression with psychotic features, and when the depression gets better, those psychotic features will just abate. I mean, it's resolved, and often that's considered schizophrenia. Then the medications figured it works, but it really was never schizophrenia to begin with. It was depression with psychotic features, severe depression. Again, it's very healing for a person to be able to talk about these experiences and get some support and figure out what is really happening in their minds and how they need to relate effectively if they are having visual hallucinations. Okay.
So, and now, what kind of a success rate are you experiencing with your new paradigm approach? How can you tell us about what your success looks like?
Well, I've worked with a lot of voice hearers over the last 3 or 4 years since I began to focus on this work more and more. If a voice hearer stays with the treatment and is willing to learn to relate differently with the voices, you will get improvement. You'll definitely get improvement. Okay. Now, what happens is that a couple of considerations. If a person has been hearing voices, let's say for 20 years, let's say from 20 to 40 or 45, often it's hard for them to make that change. They're so used to being in their own kind of internal world controlled by the voices. It's hard to bring them out of that, which is one reason why the sooner you could begin to work with a voice hearer at the onset of voices, the much better outcome. A very important aspect of working with a voice hearer is what happens in therapy when you're dealing with issues other than the voices. Let's say severe depression or trauma with their antecedent onsets before the voice hearing, that these are parts of the personality, parts of the person that need to be treated too. So what does a therapist do who is working with a voice hearer when they're trying to work on these other issues and the person's hearing voices during the session or going home and hearing voices? And that's one of the things I've also done, and we've done it at LifeLink, is we began to train therapists to actually do therapy on other issues and also treat the voice hearing at the same time. Now it's very, very tricky because years ago I remember a case where I was working with a young woman who was hearing voices. They were severe, and she really wanted to pursue some of her dreams, going back to college and whatever, but she had some early childhood experiences that really left her with low self-esteem, core level of depression, things like that. And I was working with her, and then I would notice that she'd kind of look and drift off and look away. And I would say to her, what are the voices telling you? And she said, the voices are telling me not to believe anything you tell me.
I would imagine. I'm sure you have that.
So you have to kind of know how to juggle several different balls in the air at the same time.
Yeah.
So do the interventions that work for depression, for trauma relief, working with anxiety, but also keep in mind that the voices are active, okay?
Mm-hmm.
And the voices will often undermine the therapy, and you have to keep that in mind. And actually alert the client saying, okay, we're going to work on these issues, and the voices may try to convince you that it's not going to be good for you, it's not going to help you, whatever, okay? Mm-hmm. Now again, when we're being trained as therapists, we're not being trained to work with voice hearers in this way. But,
right.
And some therapists, they can be trained. Many therapists can be trained.
In fact, I wanted to ask you that. Do you have a training program at all for people or even family members to help them deal with, how to deal with people who hear voices?
Well, in terms of training therapists, LifeLink has a training institute, and I've done 3 trainings over the last 2 years for therapists and social workers and case managers how to work with voice hearers.
With this alternative approach?
Yeah.
Okay. And how would they get a hold of you to find that out if they want to get training?
Just call me. My number is 629-7108. 629-7108, and they can call me, and if they wanted to come and talk and put together a kind of an approach, doing some readings, getting some supervision, and then getting on a list for the next formal training that LifeLink may do through their training institute.
Now, do you have to be a therapist to receive this training?
You'd have to be somehow a professional, either a peer supporter, a social worker, case manager, whatever.
Okay. And just wanted to let the listeners know we're talking to Kevin Hennely, and he is from the Santa Fe Hearing Voices Treatment Center, and that's the phone number again is 629-7108 if you're interested in pursuing any of what he's talking about, alternative new treatments, changing the paradigm in how we treat people who hear voices, or what is also commonly known as schizophrenia.
Right.
So,
well, going back to what about family members who want to relate differently?
Yeah.
And that's where the family therapy would come in. That would be part of the family therapy. To work with the stress in the family for having a family member, a loved one who's hearing voices, and often the behavior can be very problematic. How to work with that, and also how to help them listen and talk to the voice hearer, help them to understand what the voice hearer is experiencing. Because often, even within the family, the voice hearer will become very isolated because it's just too hard for family members to put up with certain behaviors, and they just get weary or they don't know what to do.
And they get afraid.
They can get afraid, and particularly if there's any aggressive behaviors, which can happen too. So I would deal right now with the family members more just in a family therapy context, and just meet with them and just give them some pointers and guidelines and help them in whatever ways.
And does it help when you bring the family members in to the therapeutic setting with the patients?
Oh, I think so. I think so. Because remember, often what happens is this. A person will end up, let's say, at the ER. Okay, there's been a crisis at home. The EMTs will be called, the police will be called, or the family would just take them to the ER. Well, they'll sit in the ER for a while, which is just the way ERs operate, which is fine. They'll eventually get diagnosed by a psychiatrist or a psychologist. And often that is when the initial diagnosis of schizophrenia is given. At that point, the family's informed. Okay, often the family's informed. It could be parents, it could be a spouse. And often the messages that they're given is get them on medication, okay, and get them on disability, and maybe connect them with one of the community health agencies in town, but they don't really give them much hope.
Yeah. Because
there isn't really treatment that's really going to abate the voices over the long term.
And that's why this program is such a better alternative.
Right. And so the family members are often getting the message that there's really not a whole lot you can do.
Yeah,
you see? But there's things they can read, they can learn that there's other ways to relate to the voice hearer, they can get some hope, just like the voice hearer can get some hope. You see, so
it's not a hopeless situation. That's the bottom line.
That's the bottom line. It's not, and that's critical, because so often it was considered a hopeless situation.
Yeah, and in fact, I was thinking, for those who choose to continue to sort of hear voices, and those that you present the option of treatment, even the alternative treatment, they still prefer to go on to hear the voices. The unfortunate thing about that choice is that then they leave themselves vulnerable to being victims of the current paradigm, the psychiatric system at large, and getting, because if they become aggressive, then they're going to get arrested and put away, and all of those situations, I would think, only increases the level of stress, and then would increase the negativity of the voices. And it seems to be kind of a lose-lose situation, whereas at least what you're presenting seems to be more of a win-win.
Exactly. And here locally, what a lot of families do is they try to keep the voice here living at home the best they can. It's a tremendous stress on the family, particularly often the mother or the parents, because other siblings move on in their life. They start their own families. They're living apart, and so often the voice here is on medication. They don't do much. They're very much dependent on the parent, often the mother or grandmother. The crisis then, another crisis comes when here the parent or the grandparent's too old to take care of them.
Right.
And I've had, over at LifeLink, I worked there for a number of years, the grandmother or the mother will come in with the 50-year-old son or daughter saying, I can't do this anymore. She's 75, she's getting old, she's getting weary. What do I do? But by that time, it's hard to affect the changes, you see.
Yeah.
It's really hard to affect the changes. But the family is very strong here in northern New Mexico, and families are willing to often keep these people at home. But eventually, it could work against them, because you can't do it forever.
Yeah,
Caregiver,
right, you can't. So the alternative is this sounds like such a hopeful alternative to really help give the voice here more faculty and choice and power over the voices, as you said, in moving forward with their life, and actually being able to function in society while still hearing voices, like the grocery store clerk you spoke of, and then the other patient you had. So the good news is there is treatment for people who suffer from schizophrenia. It looks as though these new treatments are definitely providing much more success than the older models. And I want to give away our number, and unfortunately we have to say goodbye now to our wonderful guest, Kevin Hennely. And he is, again, the founder of Santa Fe Hearing Voices Treatment Center. You can call them at 505-629-7108. Thank you so much today for joining us and giving us such a hopeful message.
Well, thank you for having me, MK.
Thank you. It's a pleasure. And thank you for joining us on Dialogue. We will see you next week again, right here, Friday at 5 on KSFR.